Hello, everyone. Myself, Dr. Sarfraz Robert. I'm the IELTS and OET expert. Today, it is a debatable question among all medical professionals, including doctors, pharmacists, and nurses, that which exam is better for them to do for their professional career, either to choose the IELTS exam or the OET exam. This video is going to unlock the secret of every medical professional to decide which exam is best for them for their international career. Let us start. I am going to briefly explain the difference between the OET and IELTS exam so that one can actually decide which exam is best for them and not waste their time and money. There are a number of difference between IELTS and OET, but the first and foremost, the major difference is language. Language for the OET is medical related language. All the four modules, including listening, reading, writing, and speaking, all the modules for the OET is related to the medical language. However, when I talk about the IELTS exam is more of general English language. It can include a science related articles, uh, anything related to the magazines, newspaper, or any novel. So this is the major difference. The second major reason is writing. Writing for OET is in this form that we need to write one letter for almost 180 to 200 words. And we have, as I said, the medical language. For example, we are going to write probably a referral letter or a discharge or something related to the further investigation. Therefore, we can consider that writing for the OET does not require an advanced English level to pass to reach to the 350 score or 7 bands. To be honest, writing is really challenging for the IELTS candidates. If someone is doing IELTS and doctors, particularly, they require 7 in each module as compared to the nurses, whereas nurses require overall 7.5 and they have the liberty to get 6.5 in the writing. But still, for the doctors, writing requires 7 band. And for writing in IELTS, we need to be really master in the advanced English language, including we need to add on the idioms, we need to talk about the collocations, we need to have simple, compound, and complex sentences. So that is another major difference. And if I'm saying that it is really challenging to get 7 bands in the writing, then I mean my words. Third important reason is speaking. Speaking for the OET exam contains 2 role plays. In these 2 role plays, we need to focus on how doctor or nurse or pharmacist they are communicating with their patients. Here in OET, they focus more on mannerism, how we communicate with the patient, how we deal with them, the words we are pronouncing, the words we are using, how we sympathizing with them, how we empathizing with them. On the other hand, when I talk about the IELTS speaking contains 3 parts: part 1, 2, and 3. Part 1 is about introduction, but part 2 is the cue card, where examiner is going to give you a cue card. It is an unknown cue card and you need to prepare it within 1 minute and you need to speak for 2 minutes non-stop. Here, the part 2 and part 3, even the whole speaking IELTS exam, they focus more towards their pronunciation, their grammatical stuff, including how good vocabulary you're using, how good idioms you're using. So I believe that is a major difference between OET speaking and IELTS speaking. The fourth major difference is reading module. Reading module has one big challenge. This is called the time management. Time management for OET candidate and IELTS candidate both have difficulties. When I talk about the OET candidates, they are more convenient to manage their time in terms of articles. The parts like part 1, part 2 and part 3 of the OET reading, all the articles are going to come in terms of medical language. I believe it's easier for them because they have been studying and going through the same material throughout their professional career in their university time. But when I talk about the IELTS reading, to be honest, it's really challenging to finish 40 questions within 1 hour for medical professionals, I believe, because the comprehension level of passage 1 is easier as compared to the passage 2 and passage 3, because passage 2 and passage 3 of the IELTS reading, they are more comprehensive and challenging for the medical professional, basically because they have not enough time to read all the novels, magazines and news in English language. Most probably that is the major reason. Last but not the least, listening module. The listening module is also different for OET and for the IELTS exam. The OET listening contains 3 parts, but one must tune their ears to listen to the English language in terms of the medical relationship. But as compared to the IELTS have 4 sections for the listening, section 1, 2, 3, 4. The major difference is the language. I believe that listening is a skill. If someone can practice listening, it is much easier to achieve 7 bands even in the IELTS and even in the OET. However, some of my candidates, they have told me that they are facing difficulty level in their listening. For those candidates, I have told them to choose OET because doctors can easily understand their medical terminologies as compared to the journal listening English language. Therefore, my conclusion is for medical professional to choose OET. And the reason is this, that if medical professionals, they do not have the hobby to read novels, magazines and news in their English context, so it will be more valuable and, to be honest, doable for all the medical professionals to do OET exam. If someone is interested to learn the examination criteria, the skills, what they need in the OET exam, and even for the IELTS, but I'm ready to teach, you can call me on my number. If you have any query, please let me know. Thank you.